What is extreme scoliosis and what can be done to help manage it? When the conversation of scoliosis occurs, the first thing that comes up is going to be size of scoliosis. And when it comes to scoliosis, the first thing you have to understand, there's a very specific definition that there's a curvature in the spine associated with rotation. And for it to be scoliosis, that curvature has to be greater than 10 degrees. So what happens when this curve gets larger? It gets rated into different severities of scoliosis. And the highest severity is something that's called like extreme scoliosis. And extreme scoliosis is when scoliosis has progressed to a certain point where it's beyond just severe, it's something called extreme. When it comes to different severities of scoliosis, a mild scoliosis is a scoliosis between 10 and 25 degrees. And in mild cases, unfortunately, the most common recommendation is something called observation. And they're just watching and just waiting and seeing what happens. And in an adolescent case, this can be a very dangerous situation because curves can progress very, very quickly. And if a curve progresses beyond 25 degrees, but still less than 40, this is where it's called a moderate scoliosis. Now, if you can see, that's only a 15-degree window. 25 to 40 degrees, 15 degrees, how fast that can happen with an adolescent patient, unfortunately, it can be way too fast. In fact, I recently just had a patient in 6 weeks progress to almost 25 degrees with no treatment. So we can see a lot of progression in a very short time. And if you're told to come back 6 months or a year later because you have a mild scoliosis and something happens that you're not monitoring or looking at this at your adolescents grow and develop, the curve can progress relatively quickly. Once you progress beyond 40 degrees, this is where it's called severe. Now, sometimes this can happen relatively quick. So you imagine going into an appointment, they said come back in 6 months, the curve starts to progress very quickly. You're not given any other instructions like to check for posture, check for height measurements, check for anything else. You just say come back in 6 months. Well, imagine you're this case, you progress 22, 25 degrees within 8 weeks of your appointment. Now you still have another 4 months to go before you go back to your evaluation. You're still progressing. And so now we can start going to these stages called very severe scoliosis or extreme scoliosis. And for me, that's curves over 80 degrees. And normally the only way somebody ends up here in most cases is because they're managed improperly. They're watched and wait too long, or they're just given bad treatment options and nothing is done to actually manage the scoliosis and reduce the scoliosis before it becomes at this size. So how does extreme or very severe scoliosis affect somebody? Well, it's different for everyone, but one of the things they start getting concerned about once you start breaking 80 degrees is where this can start now affecting organ function. It can start affecting the organs in your body. However, it's not clear. Not every patient will have this at this time, so we can have some patients have 80 degrees, 90 degrees. In fact, the biggest curve I've ever seen has been 155 degrees, and these patients sometimes are tested and they have no functional problems in their lungs or heart, but it tends to cause very severe postural issues, very big cosmetic issues. In adults, it can lead to chronic pain, it can limit their activity, it can affect mobility, it can have significant effects to lifestyle, meaning things they can participate and not participate. It has a severe emotional component because it can affect their appearance. It can lead to some self-esteem, and it can lead to depression. So what do we do if you have extreme or very severe scoliosis? What do we do about dealing with it? Well, one thing is a lot of times these patients will refuse surgery as well. How does another patient get here is a patient who just utterly refuses surgery. They say, I'm never going to have surgery. I'm not going to have a rod. I don't want to have the risks associated with spinal surgery. And they're not given any kind of treatment to manage their scoliosis. Well, the curves can progress to these size numbers. So therefore, what do we do for them? They could also have this personal preference, meaning they're worried about how the rods could affect them over life. Some patients have religious reasons why they'll never have surgery. And also when curves become this severe, there are surgeons that also refuse to operate on this type of patient. They say the operation or the surgery is too risky for the surgeon to do themselves, so they're not going to have surgery. So what do we do? Well, first thing is that we try to help these patients from the curve not progressing any further. There's some reality that we're not going to get massive reductions. Like we're not reducing these curves, 50, 60, 70%, where these curves are becoming non-surgical. But we can manage the curve. We can improve posture. We can improve cosmetics. We can improve what these people are seeing in the mirror, and that can help them with their self-esteem. That can help them with how they're experiencing their daily life. And we can also improve their ability to engage in activities. And we do this with something called a functional chiropractic-centered approach. This functional approach is trying to manage the scoliosis but improve function at the same time. And the heart of this is our chiropractic care, meaning that chiropractic care is very specifically designed to try to address what's causing these problems as opposed to just trying to deal with the symptoms associated with the scoliosis. We do this with chiropractic adjustments. We do this with in-office therapy, rehabilitation, and exercises, also customized home prescribed exercises, and in lots of these cases, they'll be using a brace. Once you hit this size scoliosis, you're more likely you're going to be doing this type of treatment or this type of therapy for the rest of your life at some level. Initially, the care is very intense, meaning we're trying to reduce the curve and manage the scoliosis and try to get as much as we can off of it. But normally you'll get bridged over into this maintenance phase where now you'll be maintaining your scoliosis at a certain level. And this will require a lesser engagement, but you're going to be doing something. So my recommendation is if you have extreme scoliosis or very severe scoliosis, 80 plus degrees, you don't want to wait, because we definitely know in adults, very severe scoliosis will progress faster than like a 40-degree curve. So you want to start dealing with it now. And so therefore you want to find a provider who specializes in this and has dealt with it before. Ask your doctor, hey, have you ever seen a curve this big? Have you worked with one? What are the results have been? Because these types of cases respond very differently than like a 30 or 40-degree curve. So I definitely recommend that you commit towards being proactive and you try to work with your scoliosis, because if not, it's unfortunately at this size, it will still progress. But there are options and there are things that you can do to definitely help you so you don't have to suffer all the consequences of having that type of scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.